And welcome back. I have with me Dr. Yeung, and he is from the Nash Heart Center. We're so glad to have you on, Dr. Yeung.
Thank you, Sandra. It's a pleasure to be here.
Absolutely. Again, we're so glad you agreed to come back because this is National Heart Month, and Nash Healthcare realizes how important it is to impart information to you for prevention. Prevention's always that's the most important thing. Wouldn't you agree, Dr. Yeung?
Absolutely. I think, preventing the problem from happening is so important. And, a couple of weeks ago, Dr. Martin actually, took a really big role in championing doing a health prevention clinic in which patients came in and checked their blood sugar and checked their cholesterol. So we really want to be able to kind of tackle the different areas in cardiology. But prevention, like you said, is absolutely essential.
Absolutely. And I do appreciate y'all having this fair because I'm sure a lot of people benefited. I know a lot of people benefited from this. So again, we want to thank Nash UNC for realizing, this is Heart Month, and they are partnering with us. They're realizing the importance. So thank you for coming again. This morning you're here for a different reason.
I am.
An exciting announcement is coming.
Yes.
So I'm going to let you tell us what it is.
Yeah, Sandra, what we've noticed in the last 2 years that we've been here, we, in many ways, we came in mainly to help for the heart attack program at Nash. Now, as we're growing, we want to be able to deliver comprehensive cardiac care at Nash. And one of the things that we really realize is that valve disease in the area is really under-recognized.
Right.
We have seen a lot of patients with valve problems, the aortic valve and the mitral valve. And a lot of times when they come really late. They come when they're very, very sick. Mm-hmm. A lot of times they think it's their lung disease that's getting them to the hospital. But actually, when we start looking into the heart, they have a lot of valve problems. And so we want to be able to kind of provide that expertise to them.
But you don't hear people talk about valve disease at all. I don't think we think about that until we are sick, because we think about heart attacks and we think about other things, but we don't think about valve disease.
You're totally right, and that's exactly what is under-recognized. People don't think about it that much, but that is actually a major part of cardiology as well. Dr. Vavali, who's going to be running the valve clinic along with me, we started the valve clinic at Chapel Hill about 4 years ago. And he did a study showing that in different parts of the state, actually, there's a high prevalence of valve disease, especially in the Eastern Carolina area.
Okay, so you will do the valve disease procedure. Is it invasive, non-invasive? Tell us a little bit about that.
Yeah, so I think that the first step is to catch the people, to be able to recognize that they have the valve disease.
Right.
There are different degrees of valve disease, and depending on what valve, we can offer them different things.
Okay.
The valve clinic, what we want to be able to provide is provide that expertise that we would have, that anybody who goes to UNC, they'll have the same expertise coming here to the valve clinic at Nash. And we will work them up, and our concept is to hopefully be able to do most of the work up here at Nash.
The pre
exactly
is done here.
Yes.
Okay, at Nash.
So all the visits are done here, so they don't have to travel to UNC or Rex or other place. Mm-hmm. And most if not all the work will be done here.
Okay.
And then for the procedure itself, they will have to go to UNC to do the procedure. Mm-hmm. The other thing about valve disease is that traditionally we think of that as mainly a surgical approach, meaning if you have aortic stenosis or mitral regurgitation, most people have to go to surgery, but not anymore.
Which splits the chest.
Exactly. Previously, they will have to get their chest open in order to get open heart surgery, and that's very invasive. But depending on the age group, depending on their medical problems, right now we can actually do a lot of these procedures through the groin, through a minimum invasive approach.
Wow.
And we can actually replace the whole valve through the groin without ever opening the chest at all.
Wow. Which this is called percutaneous.
That is called percutaneous. That's the term for the aortic stenosis is actually called TAVR. so transcatheter aortic valve replacement. And we do it on patients that are actually elderly that will not be surgical candidates.
Right.
And for example, the oldest person I've done for a valve replacement through the groin is 92 years old.
Oh, my word. I mean, that spells hope. Wow.
Yeah, so the idea was that, is that traditionally for the elderly people who are 85 or 90, who are still otherwise in good shape, we want to make sure that they're
Right.
functional, they're ambulatory, they're really an integral part of the family, and they're still very connected with the family. That if we replace the heart valve, they can actually continue doing so. And case in point, that 92-year-old lady that we replaced the valve at Chapel Hill,
Amazed.
she was able to dance with her great-granddaughter afterwards, a few months afterwards.
That's just unreal, because it's isn't it kind of dangerous? I'm just, saying that as a layperson. Isn't it kind of dangerous to, have to do the total
The open heart surgery.
open heart surgery on a 92-year-old?
Absolutely, they wouldn't, right? The whole procedure has been around for now 17 years. And the way that, the cardiologists pioneered that was actually in France. Alain Cribier was actually the first person who designed this approach. And the idea was that he had a lot of patients that were in their 80s and 85-year-olds that the surgeon will say, no, they're too sick to get surgery. So all we're going to do is manage it with medications. And medications will only do so much. And we found out that medication, when you have severe aortic stenosis, for example, within a year or two, they will not be around with us anymore.
Wow.
So he really kind of championed and pioneered this approach in order to find a minimally invasive procedure that we can help people, and then be able to take care of the patients, who are still very loved by their family.
I'm just so impressed. Goodness gracious. Well, some of the statistics, about 5 million people are affected by this, but the general public is shockingly unaware of its prevalence. So that's exactly what you said, but 5 million people is a lot. That's a lot.
It is.
So let me put this in perspective here. Okay, we can get our pre-op done right here in Nash, so we don't have to travel. We go to UNC and we get the kind of non-invasive procedure done. We come back here for our post-op as well.
Yes.
Right?
Yeah. So all the pre and post will be done here at Nash. The only part, so we're hoping that what we can do is streamline everything, so all they need to do is do that one trip for the procedure. This procedures still require a lot of equipment, still need to have a lot of people to be trained to do that, and so I think that we feel good that this procedure should be done in a medical center like UNC.
Right.
Right. But before and after, we can definitely follow them here.
Absolutely.
That way it saves them a lot of trips.
And that's important. It is important to be able to stay home, stay here. We've talked about that on the show before. It's just so important to be able to stay here. When do you start doing this here, the pre and post? When does this start?
We're starting the first week of March. Yes.
Okay.
We're going to have this kind of like an inauguration. We're going to have a ribbon we're going to cut and everything.
Good.
It's coming Thursday, Thursday afternoon at 5 o'clock.
We will be there with the camera.
We're going to invite all the patients that we've actually taken care of in terms of the valve disease.
Oh, really?
Either surgically or through this minimally invasive approach. And so they're all going to be there, and they're going to mingle and talk about their experiences.
Wow.
And invite some providers as well in the community so that we can create more awareness. But we're going to have an inauguration on Thursday, and then we're starting in March.
Well, it's always good to hear testimonials of people that have had the procedure before. It always makes us feel better for them to let us know that they did fine, everything was fine, and it gives us a little bit more security. And we appreciate, Dr. Yeung, your reputation is so wonderful around here. When I talk to people, they say, oh, Dr. Yeung did my cath, Dr. Yeung did this, oh, he is wonderful, wonderful. I mean, I've talked to many people that you have done various things, from a cath to a stent, whatever. And we really appreciate you being here. We're so glad that UNC sent you to Rocky Mount.
Well, thank you. Thank you very much. It's been a pleasure being here. And what I can tell you is that in this last 2 years, I've really gotten attached to a lot of my patients. I think of my patients kind of like family and friends, and I've gotten tremendously attached to all of them because they're just incredible people.
Well, we appreciate that, and that's what they say to me, that you just treat them so well and make you feel like, I mean, they do make you feel like family, and you make them feel like family, and it's just a wonderful relationship with you that the patients have. So, again, thank you for being here. We can't wait for the celebration on the 22nd, which is Thursday, and we look forward to having yet another great procedure done in the Heart Center at Nash. It's really, really come a long way. So anyway, thank you for being here.
Thank you, Sandra.
We'll be right back.